We go back years now, and we will always support the Senior Center. We feel like our goals align so very well that it's just a perfect partnership. We know that for you to stay engaged, it is so important for you to be involved, and for you to stay young and healthy and vital, you have to stay engaged. And if you can't hear, it's very hard to be engaged. So we feel like our goals align very well, and we want to be here for you so that you can continue to offer our community the importance that you have. And you offer such a big role in our community. We learn from you, we learn from your experience and from all that you have to offer us. And that should be played out even more in your senior years because you have so much more to offer. So we want to help you be able to do that. So May is a prime month that we like to come to you and talk about these hearing health needs, because May is Better Hearing and Speech Month. So communication and hearing care is essential every year, but we've also noticed it even more so in the virtual environment. It affects a lot more than we had even anticipated, and you don't think about that until something's taken away. And so in 2020, we learned a lot about virtual environments and the needs of hearing impaired individuals. So today we're going to kind of break our expo into 3 segments so that we can allow some time in between and maybe interact and get some information going back and forth between those of you that are watching and us here in the office. So the importance of treating hearing loss is going to be our first segment that we'll discuss. And we'll have some time at the end of that to ask some questions. Then we're going to jump into some hearing challenges and the more challenges that we've experienced during these challenging times. We're also going to talk about at the end, we're going to have a segment on hearing loss and how that affects other healthcare issues. And so we'll talk about those concerns and how they're related. Let's jump into the first segment of our expo today. And we're going to talk about the importance of treating hearing loss. 33% of adults that are 70 and older have a hearing loss that impacts their daily communication. But it's shocking to know that only 25% of adults that have significant hearing loss actually use a hearing aid. And on average, it takes a person 7 years to seek treatment from the time they first notice they're having a problem. And I know that many of you may be that one, or you may have a family member that keeps postponing it, keeps putting it off. And whether you're on the first idea that you might have a hearing loss, or you're on year 6 or 7 of going, I know I have something wrong and I need to take care of it. It's not too late to look at, how do I really have a problem? How is it affecting my communication and my ability to communicate with my family members? When you think about those signs of hearing loss, it's important to think about the things that we know that we tend to see first are going to be the person that asks for a lot of repetitions. If you find yourself or you have a family member that is asking you to repeat frequently, that's a big sign that there may be some form of hearing loss there. Another noticeable aspect is turning the television or the radio sound louder than an average person would want to listen to that. If people in your family are saying you're listening to that very loud, then that's a sign that there might be hearing loss there. Difficulty understanding speech and conversations in a group or in a large crowd is another big sign of hearing loss. And then the complaint that everybody's mumbling. And that's the easiest trap to fall into. Hearing loss is gradual. It's very gradual over time. And we think we still hear the same as we've always heard. And so it's an immediate response to say, you're mumbling, you're not talking clearly. And indeed, you might have a family member or a friend or two. I've got one in my family that really mumbles. So I'll give you that. You can have one or maybe even 2 people in your life that mumble. But if your thought is everyone's mumbling, chances are that the problem might be hearing loss. Some of the more subtle signs of hearing loss we don't pay attention to as much. And some of those are situations like where if you find yourself pulling back from wanting to socialize, You don't want to go to the dinner party. You're okay if everybody else goes and you stay back. Or I'm just going to sit here in the living room while you all gather around the dining room table. If you find yourself pulling back, or you see a family member pulling back from socialization, that's a much more subtle sign of the fact that there's hearing loss. Not participating in the group conversation. You're there, you go out to dinner with them, everybody's talking, and you kind of just hang back. We're sometimes afraid. I don't hear what they're saying. I'm not sure how I'm going to answer that. I didn't catch all of that. So we don't want to embarrass ourselves. And so we find ourselves just not participating. It's easier to just not participate. If you find yourself feeling anxious in that type of an environment, you're in a group situation and you feel that anxiety level rising, that should be a tip off to you. Take note of that. That might be a good idea to have your hearing checked and see where you are. Even a change in your personality. You might find that you're quieter than normal, or you might see a loved one that's quieter than normal. I've had family members tell me he used to be the life of the party. He was always cracking a joke, and now he just hardly says anything. Those are signs of hearing loss. Even a bad mood. Maybe you're being told you're grumpier than you normally are. Sometimes having hearing loss causes us to be in a situation where we feel like we're angry because we don't know what's going on. It's a scary feeling. And so sometimes what comes out is that situation of feeling unsure about myself. So I'm going to come off more on the attack to kind of stay in control. So pay attention to those things and look at them, and maybe seek help when you need to have your hearing tested to see, where am I in that? Is this maybe what's happening to me? Another subtle sign, and this one is really hard to see, is fatigue. We think, okay, well, it's been a long day. Maybe I'm just getting older. I don't know why I feel so tired today. Maybe you were having to engage a lot. Maybe you were in a lot of group situations that day, and you find yourself more tired than you normally would feel after a social event. Those are signs of hearing loss. It takes effort to listen, to figure out what's being said. And that effort can cause you to be physically more tired. And when you're more tired, you often have memory problems. And you might find yourself thinking, gee, something's going on with mom. She doesn't seem to remember. I talked to her about that yesterday. Maybe mom's hearing is changing and she didn't get it all. We're sometimes afraid to admit we didn't get it all, or we ask for a repetition and we still don't understand. So we just pretend we understood. I know everybody's experienced that somewhat, or has had a family member pretend they understand. And then you really didn't hear it. And then later it comes up, hey, what about so-and-so? And you feel like it's the first time you've heard it. Well, sometimes that can be misread as maybe having a problem with your memory, or even our concern of dementia or early signs of Alzheimer's. We start to worry about other things. That creates more anxiety, more stress. You're going to hear less well the more you're anxious and stressed and overtired. And so it just becomes a big vicious cycle. And so it needs to be addressed. Let's start at the beginning and go, let me see where my hearing is. Let me see if it's something as simple as my hearing. That would be a good thing. So if we don't treat that, and by treating it, I mean hearing aids, okay? So if I don't take care of that, and sometimes hearing loss is treatable with other measures, and I'm not going to go into a lot of those today. Today, we're going to talk about what we call sensory neural hearing loss, or more permanent type of hearing loss. But realize that as you get tested, we can find out how to treat the hearing loss. Hearing loss can be treated one way or another. If it can't be treated medically with a surgery or some type of medication, then we might be looking at hearing aids. So we're going to talk about hearing aids as the form of treatment today. If we have a poor hearing pathway to the brain, our ears are a means of transmitting information that I hear with my organ of hearing on both sides, and they both send a message to my brain, and that's where I hear. I hear up here, and I'm able to understand and put it together and sort things out because of my ability to hear. If I have a poor pathway to that brain, then I'm going to have a poor understanding of speech. What's being said to me? I didn't get that. And just as we talked about in just the previous slide, memory problems, fatigue, frustration. When you become frustrated and anxious that I'm not hearing in that environment, we want to isolate. We want to step back from socialization, engaging, and then we become isolated, which can lead to depression. It can lead to all kinds of physical ailments, sleep disruption. And then we are at a higher risk for cognitive health concerns such as dementia or Alzheimer's. Hearing loss and hearing aids. Well, we know the best way to decrease the progression of dementia or any type of cognitive disorder is to be active and engaged. And you've all heard your doctors say, and we know how important it is to engage, stay involved, make your mind work, play games, play puzzles, word puzzles. There's all types of different ways to keep all the areas of your brain functioning. And the more you use it, the better and more active it becomes. The less active it becomes, then we start to atrophy or decline. And we don't want to see that. So treating your hearing loss with a hearing aid is going to help you be able to stay more engaged. If I can hear easier, then I'm going to eliminate a lot of that problem with that cognitive load that I'm having to deal with because of my hearing loss. And now I can put more energy into the activities, and the brain stays more active in the areas that it needs to be active in to keep you healthy and keep your cognitive functioning as it should. So some of the best ways that we can do that are to think about getting that dreaded device that we don't want to get, but sometimes it means hearing aids. And when we do that, it's going to improve our communication with our friends and family. It's going to literally improve the quality of your life. And you're going to have a less of a cognitive load on the brain as it's having to deal with all of that. And we're going to see in a couple of minutes of how that plays out and how effortful it is to hear when you have hearing loss. But you'll find another benefit being at the end of the day, you feel less fatigued. You can remember better. You have easier social interactions and you want to stay engaged. So that's a very, very important thing to remember, is that the effects of this are longstanding and they are a cumulative effect. Just like you lost that hearing gradually, as you begin to hear, you start to be able to re-engage. We start to activate areas of the brain that improve with time, but it takes that consistent effort and it takes actually wearing the instruments. So sensory neural hearing loss is the area that we're going to talk about today. As I told you, there are different types of hearing loss. You can have a conductive hearing loss, meaning there's a problem in the middle ear. And I'll just point to on this picture with my mouse there. I hope you can see that, but this is the middle ear and this is the area we're not going to talk about, okay? So as you come into the ear, sound travels into the ear. It moves those three tiny bones that are in your middle ear. You probably learned about those in school, the three smallest bones in your body. If not, it'll be a question on Jeopardy and you'll be ready to answer it next time. But those little bones transmit information and energy to the sound to continue it to move into the inner ear. The inner ear, this is the area that we can't see when we look in the ear. And this is the area that's so important to transmitting information to your brain. And when we have a breakdown in that system, whether it be in the organ of hearing itself, which is the cochlea, or whether it's the nerve processes that carry that information to the brain, it's what we call a sensory neural. Sensory being the organ of hearing, the cochlea, neural being that nerve pathway to the brain. So whether the breakdown's in one of those two areas, that's a permanent type of hearing loss. And that loss needs to be treated with hearing aids. It can be due to many reasons, many causes. The beautiful effect of aging every year, everything starts to decline slightly, and we have small decreases in our ability to hear from the time we hit about 20 to the time we are in our 70s, 80s, 90s. Many of us are living to 100 today. So we take good care of ourselves and we have a long life. So we want that life to be quality. So that's an important thing to think about. But also ototoxic medications, your noise exposure risks. Sometimes people who've worked around a lot of noise, and we'll talk about that in a segment as well, but noise can cause additional hearing loss. It can be from a viral situation, or sometimes we don't know what it's due to. But it's a gradual decline, and typically affects the high pitches. And we'll talk about that in a minute, but I just want to talk just for a second about this organ of hearing, the cochlea. This is a cutaway of it. It's all encased in bone, and you've probably seen pictures of it before. It kind of looks like a little snail in its bone. It's about the size of my pinky finger or an eraser on a pencil. It's very, very small. You have one in your right ear and one in your left ear. So we have two. So we have to address hearing by both sides. And if I were to be able to unroll or unravel that cochlea so that it wasn't in that shape of a snail, and I like to think of it as a party blower. I should have brought one with me, but if you've ever seen those little children party blowers and you blow it and it stretches out and then it rolls back up, in the very center of that roll is, if I unrolled this cochlea, would be the low frequencies. On the outer portion of that blower, as I blow it up and it rolls back, the one that's the loosest area is the high frequencies. And that's why your high frequencies are more easily damaged. The low frequencies are very protected, tightly wound into the center of that cochlea. So it's not as exposed. And hearing loss can be caused by a number of things. And typically it's going to hit the high frequencies. Those little tiny microscopic hair cilia are in fluid inside that cochlea, and they're responsible for all the pitches. And those pitches, the cochlea, as you roll it out, is tonotopically arranged, meaning it goes from high pitch, gradually getting lower pitch until I get all the way to the end, and that's the lowest pitch. Low pitch being like a foghorn, high pitch being like a high pitch whistle, okay? So as that rolls up, all my low pitches and going into the mid pitches are more protected with more bone and more things surrounding it. So they're not as exposed. So we will frequently have problems with high pitches more than low pitches. There are certain situations that can cause it to be an opposite kind of hearing loss. But when we're looking at hearing loss just due to natural aging or even noise exposure, it's most likely going to be a high-pitched hearing loss. So we're going to talk about what that means now, because, okay, what does that mean? High pitch, low pitch, and how does that affect my understanding of speech? So I'm going to show you right now what we call the speech banana, okay? The speech banana is, if you can see here, and it's in yellow, so that kind of helps you understand why we call it a speech banana. As I'm looking at pitch, this is a picture of the audiogram, or the graph of hearing, how we track and plot your hearing, your ability to hear. What's your sensitivity for each pitch? So if I'm on the left side, and hopefully you can see my cursor moving here, if I'm on the left side of this graph at the top, that's the pitch. These are low pitch sounds, okay? I'm gonna liken that to a foghorn. As I continue to the right, as I'm getting progressively higher in pitch, for any of you who are musical, you understand how pitches progress higher and higher as you go up the piano, until we get to probably like somewhere around here, around is middle C on a piano. And then as we continue to go higher in pitch, we're getting to those real high pitch whistles. So that's a progressive look at that. There are far more frequencies or pitches in your organ of hearing than what we have represented on this graph. But we have found and learned over time with research that the areas that are most important for speech understanding fall in this range right here. And that's why typically these are the pitches that are tested when you go to get a hearing test. And so we plot on a graph, much like this in the diagram, how loud did I make that pitch for you to detect it? I just barely think I heard it. There's something there, and we'll typically start louder. So on the left side, going down of this graph, this is your loudness level in decibels, okay? So the top, and it says low up here, the top of the graph is very soft, imperceptible, 0 decibels, until I get louder and louder and louder and louder. The sound of a jackhammer or a jet engine, okay, 120 decibels. So that is a loudness scale. So as we come across and test your hearing, we'll start out with a level at 1 pitch, say, to where I know you can hear it. Well, nice and strong, about 50 decibels. I'm talking to you right now at about 50 decibels. That's normal conversational level, 50, 55 decibels. So that'll give you a perspective of the loudness of it, okay? So we'll start there and you'll hear that. So I'll make it softer and you'll hear that. So I'll make it softer and you'll hear that, and we'll keep going. If you have normal hearing, somewhere in this area, right about here, 10, 15 decibels, you're going to stop hearing it at some point. I'm going to get to maybe 5 decibels and you're not going to respond. So I'm going to come louder again until you respond again. Oh, yeah, I hear that. Maybe. It's really soft though. I'll go softer again. Nope, didn't hear it. I'll go a little bit louder again. Yep, you really heard it. Where you hear something, where you detect something 50% of the time. So that's barely perceptible. It's what we call your threshold of hearing. Okay, a lot of people get concerned when they have a hearing test because they say, no way in a real life situation would I have heard that. I was sitting in your quiet, soundproof booth and it was so soft, I thought my breathing was going to cause me to not hear it. That's not a representation of my hearing, but it is, because what we're looking at is softest ability to perceive sound. That's based on normative data. That's been studied for many, 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 many years and over many, 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 many subjects. So if we can find out what's the area that a person with normal hearing can, the softest level they can perceive, we can start to learn something about your hearing and then how we might need to help that or aid that, okay, at the individual pitches. So as I go through each pitch, I'm able to find and plot where you hear each pitch. If you have normal hearing, we'll have little marks straight across in the middle of this. Now we're going to talk about what does that mean in regard to my speech. So as I'm talking to you right now at a normal conversational level, all my speech is coming to you at various pitches and loudness levels. So this is the part to hold on to. When I'm saying a word to you, my word is made up of some low pitch sounds and some high pitch sounds. We frequently say, oh, a woman's voice is high pitch. Our voices in general tend to be more high pitched natured than a man's voice, but my voice has some low pitch sounds. A vowel or a voiced consonant is going to be a lower, louder sound. So I'm going to say some vowels for you. Ah, oo, e. Okay, nice, strong, happen right around 40 or 50 decibels. Some of them do. Some of those voiced consonants, you can see the letters here. The letter represents the sound. So not me saying B, but me saying the sound B. So if I isolated just that sound and I made it stronger than I normally would, but if I said banana, that B was a fairly strong sound. It was, around 40 some odd decibels, and it's kind of low in pitch. But when I make the sound of an F or an S or a TH, it's just almost air, and it's very high pitched and it's very soft. I'm going to make the sound of an S. Unless I really enunciate it hard, that's not how we talk. We don't talk like that. I say the word say. That S is very, very soft, has very little energy, very high pitched if we isolated it and measured just that sound. So that concept we kind of need to understand and get in our mind to understand why we have trouble understanding speech. I hear you, but I don't understand what you said. And I know most of us can relate to that. Even normal hearers have trouble at times where, oh, I heard you, but I didn't understand that word. Okay. So the reason for that is where all our speech sounds fall. If I grab them, if I make just that sound and I'm not putting effort into my conversation, but I'm talking at a normal conversational level, that's where those sounds fall. So that speech banana is an important understanding to understand why we have problems when we have hearing loss. So with that in mind, we're going to look at some speech bananas with some graphs plotted over it, okay? So here's a response, and you can see, remember we talked about this being that soft, almost imperceptible range. This person heard all of the pitches in a nice, soft range. They have normal hearing. If you notice, all their marks are well above all the speech sounds. So obviously, if you can hear softer than where my speech sound is, you're going to detect my voice with no trouble at all. We're going to have a great conversation. We can probably even move this conversation into the middle of a noisy restaurant. And hopefully this year we'll be able to start doing that, moving back into restaurants, things opening up, getting back together at the senior center, fun times. Those are challenging environments. And if you have normal hearing, I can probably still carry on a great conversation with you at normal levels if I have this normal hearing. Well, what if I have mild hearing loss? I oftentimes have people in my office saying, oh, okay, yeah, I see on your graph, I've got a little mild hearing loss, but I'm going to wait till it really gets bad before I do anything about it. I don't want to go into hearing aids right now. We are doing ourselves a big disservice when we do this. There's a lot of reasons for that, and let me kind of go over a couple of them. But first, thinking about that speech banana, here's our sounds where all those sounds occur, and now here's my plotted audiogram. Here's this person's hearing loss. This is a mild, relatively high pitch hearing loss. In the low pitches, they're falling in normal. So this person can hear the vowels and the voice consonants very well. The volume of my voice is carried in those sounds. Those sounds make my voice strong. I hear you. I don't need it louder. I hear you. But I don't hear these sounds, a soft P, a K, an S, a T, a TH. I even struggle a little bit with SH and CH. Notice the line is right on top of those sounds. I can just perceive sound where you make that sound. So I heard you, but boy, I'm not sure if that word was kin, fin, thin, sin, pin. I don't know, it could have been any one of those. So then we have to have conversation. We have to depend on our conversation to understand, that's what you said. You said thin. So those are the typical problems we start to see. Great one-on-one. Somebody with a hearing loss like this says, I do fine. I'm hearing you just fine. I'm hearing every word you're saying. But if we move this conversation into the middle of the senior center when there's an event happening, or over to a restaurant where there's a lot of people conversing around me, they're going to start to lean in, go, what did you say? Or the waitress is going to come to the table and I'm not going to hear the specials. I missed part of that. I heard what she was saying. I know she's talking, but I don't know what she said. If I have just a high pitch hearing loss, here's a person who's got very normal hearing for all the low pitches, but those high pitches you can see drop off to, look where our decibel level is over here, 80, 90, 100 decibels. They just perceive that sound. Now remember, that's a loud sound. If you had normal hearing and I let you listen to a high pitch at 100 decibels, you would say, whoa, that's very loud, stop doing that. This person can't even begin to detect it unless it sounds almost like, maybe you made it, I'm not sure, just like the normal hearer did at 15 decibels. That's a big, significant, high-pitched hearing loss. This person's going to have extreme trouble in a noisy environment. They'll do great one-on-one. This is the person that gets accused of having selective hearing. The wife says, take out the garbage, and they heard you just fine when they were standing right next to you and looking at you, and we were having a conversation. You're in the living room reading your book, and she says from the kitchen, take out the garbage, and he doesn't move. And she says, why don't you respond? You don't hear me. You just choose not to hear me. You heard me just a minute ago. It depends on the location, the environment, what's happening. Were they ready to listen? Because that disruption of ability to truly understand what's being said was now not aided by the fact that I'm listening, paying attention, looking at you, know we're going to talk. And so we're going to get into that a little bit more, but that is very, very important and crucial to understanding why sometimes family members can hear you, or maybe if you're the hearing impaired person, sometimes you hear them, sometimes you don't. It makes you start thinking, well, maybe I don't really have a hearing loss. I'm not sure. Somebody with a severe hearing loss. Okay, so now we're looking at this line here. Their loss is a very, very severe at all the pitches. This is the person that's not even hearing us. You have to talk very, very, very loud to them, even one-on-one, okay? So hearing loss affects conversation and communication for everyone that has hearing loss. It just affects you in a different way. But they all need to be addressed to keep that proper auditory pathway stimulated, that area of the brain active, and to protect you from risk of further cognitive disorders, as well as the many other problems that come along with that. We talked about the anxiety, the cognitive load, the exhaustion at the end of an event because you work so hard to hear. So I'm going to show you why a person who hears not all of the sounds works so hard to hear. I want you to look at this message there and see if you can read that. Now you're probably able to read that. There's enough information there, but you didn't look at it and instantaneously knew what that said. You had to work at it a little bit. This is what deaf or hard of hearing people feel when hearing. You got to kind of piece in some more information. People, that must be people, speak to them. It is hard work. Okay, so indeed, if you're missing those high pitches, remember that person with the high pitch hearing loss that was losing those high pitches, they have to work that hard to hear. So their brain is having to do the same effort that you visually just made yourself do by reading that. And they're working like that all the time, and they don't even realize it. And so you get tired, you get fatigued, you get a little grumpy. You don't want to participate. You say, go ahead and go to the party without me. I'm good. I don't hear what everybody's saying anyway. Sometimes even paranoia starts to set in. If you don't know what everybody's saying and they're all around the dinner table and everybody starts snickering, they sometimes feel like, are you laughing at me? Did I just say something wrong? Did I just say something foolish? Did you talk to me and I didn't hear you? And you get embarrassed and you start to feel like, oh, I don't know. I don't want to even go. And so you start to become a different person. Let's stop now and have a few questions and answers. And these are some polls that we would like for you to participate in. So in just a minute, my technical genius over here is going to pop up a poll question. And this first question is on there now, and you'll see it. And I want you to answer that. Take a few minutes, and if you'll answer that, and all your responses are anonymous, so nobody's going to know what you said, but when do you feel like you have the most trouble hearing? Is it at home with families? Is it in groups or restaurants? Is it when you're on the phone? Maybe when you're in a large auditorium or a place of worship? Where do you have the most trouble? Let's give everybody a few minutes to respond to that and kind of get an idea of what we're experiencing. And it's kind of fun to see I'm not alone. Yeah, we're getting some good answers here, and you can see those percentage. I don't think I have them shared with you yet, but in just a minute I will share the responses. I'm going to give everybody a few more seconds to respond. We're almost at a minute now, so we'll give you another 10 or 15 seconds to respond, and then we'll share the results with you. All right, I'm getting ready to cut off, and we're going to share those responses with you now. And you'll see that 23% of you have the most difficulty at home with family. 69% of you have trouble in groups or restaurants, and just 1% on the phone. And nobody mentioned in a large auditorium. Okay, so this will help you see the kind of what we tend to see too, is that maybe you're finding that you have a problem in more than one of these areas. Our poll wasn't able to give you a chance to answer more than one, but you might be having a problem in all of those areas and you chose your biggest one. But just know that you're not alone. And this is what we hear by and large in the office, is the biggest problem is when I'm in a group setting. When I'm in a group setting, when I'm in a restaurant, I struggle. I do not hear well in noise. And so that's what our poll is showing here today too. That's true. And though you may have trouble in more than one area, that tends to be the largest problem. And so it's something that we really do look at a lot with answers in amplification and hearing devices. We'll have a segment where we talk about that a little bit too. Let's go on to another poll question now. And at the end of this, we're going to do a couple more questions. At the end, we're going to draw a name, and we've got a couple of prizes to give some of our participants today. So when we draw a name, we're going to call out that name, and then if you would, in a chat, nobody else sees it, it just comes to us. In the chat, type your full name and phone number. That would be wonderful. We want to be able to get your prizes to you, and we will deliver them to the senior center, and then you can pick them up at the senior center at your convenience. They'll be at the front there. So we're going to have another question now, and then we'll have a drawing. Two more questions and then a drawing, but here comes our next question. Did the results actually share, or did I need to say share results?
It did actually.
Oh, okay, so do I need to turn that off now? I'm asking my technical genius some. This is where you rely on your resources. And much like we want you to rely on us, I'm relying on my resources right now. All right, so we're getting ready to have another question now. And you should see it in there. What do you find more difficult? Do you find it more difficult to watch television, talking over dinner, talking in a group, or one-on-one conversation? And again, you might have more than one answer. You might find it difficult in several environments, but choose the one that's the most difficult for you. We'll give you a few seconds to respond to that. We'll do about another 30 seconds to give you time to answer in. All right, in about 3, 2, 1, we're going to cut it off. All right, and here comes our poll, and we have 17% of you say you have more trouble watching television. 8% have difficulty talking over dinner, 67% talking in a group, and 8% with one-on-one conversation. And again, these are really no surprises. Group situations are very difficult, I would say, and it's interesting that the next largest difficulty is watching television. Dinner and television tend to be really difficult in groups that we hear typically from patients. So I think you can see those results. Before I get to the third question, let me just share a little bit about that. Television, something being a medium that's coming across from something else and then coming through your speaker and having to get to your ears, even if you wear hearing aids, can be very trying. Television shows are oftentimes have a media that is got a lot of background noise going. We have ways of trying to make things sound very, very natural and normal, and really almost like you have to feel like you've got to make it sound like they're there. And that can be really trying because it can cause you to not be able to hear the conversation. So that being said, realize that that's always going to be a difficulty, and there are some answers for that, and we're going to offer some more helps with that as well. But talking amongst a lot of people, talking at the same time and over the dinner, around the dinner table with everybody talking, can be really difficult. All right, we're going to take those away and give you your third question, and we'll give you a minute to answer that as well. And then we're going to draw a name of our participants. And here's our third question in just a second. There it is. All right, I have not gotten hearing aids, even though I need them because they're too expensive. I don't want the hassle of having to wear hearing aids. I don't want my friends to see them. I don't think I will like them because my friends don't like theirs. Let me give you a couple minutes to mull that over, and perhaps you do have hearing aids, but maybe you had that issue or know somebody else, a friend or a family member that's not doing it. What's the biggest reason people don't want to purchase a hearing aid? We'll give you another 15 seconds or so. Make sure everybody has time to chime in. We've got about 5 more seconds, and we'll cut it off in 2, 1. We'll end our poll. And we're going to share the results now. You can see 36% say they're too expensive. 64% to say, I don't want to hassle with them. Those were our two. We didn't have anybody respond to the other. That is very, very common as well. The two biggest problems are the expense, and then it's something else to deal with. So let me address the elephant in the room first and talk about the expense, even though that wasn't the larger issue. Clearly, people are saying, okay, I would invest in it, but man, I just don't want the hassle of it. But let me talk about the expense, because hearing aids are expensive. There are so many options today. Technology is not the same as the technology even 5 years ago, but hearing aid technology has improved. Expense is always there. We're always paying for the research and development of the next technology that, might even wash our windows for us. I don't know. I'm always amazed at, I think I've seen the tops of technology. I have fit hearing aids for 35 years. So literally it's crazy to me to see what we do today with a hearing aid that I never thought was possible. So what's going to happen 5 years from now that I can't even begin to imagine, I don't know, but that's what we're paying for, is that research and development. However, that being said, there is ways. There are hearing aids that can be very budget conscious, that are still technologically advanced. Now, you can't expect it to perform like a high-end hearing aid. There is a difference in hearing aids. There's a difference in those costs, and there's a difference in how they perform. But there are budget hearing aids when we just got to at least have some hearing. There are also ways to stretch out payments. There's ways to stretch out payments for 3 years and make even high-end hearing aids, premium hearing aids, very affordable. So there are always options, always answers, and we are happy. We do our consultation visits at no charge, so we can sit down with you. It's sometimes just a fact-finding visit. Make an appointment, make sure you have an up-to-date hearing test, but we'll sit down with you and talk about what your options are. You don't have to make decisions at that visit. You don't have to do anything but learn and get information. Don't not do it because you're worried about the expense. Come in and get the information, and then you're armed with information and can make a better decision. Let's talk about, I don't want the hassle of dealing with hearing aids. Some people feel like a couple of things play into that. Sometimes we feel like I'm admitting I'm getting old if I get a hearing aid. The important thing to remember is people of all ages need hearing aids, okay? So it isn't that you have to worry about that. I do want you to realize that it is oftentimes more of a hassle to have to deal with all the health ramifications that come into play because you didn't want to deal with hearing aids. So yes, it's another thing you have to put on. Again, they're making those easier, rechargeable, so I don't have to deal with changing batteries, all kinds of answers for these things. So I do want you to not take this information and say, I just don't want to do anything with it. Address it, take that first step and do something about it and see if you can't help yourself, or at least arm yourself with information. All right, we're going to draw a name and we will announce that name and see who our winner is for this first segment. Our next two segments are we're going to have two winners. So I'm going to draw the name right here so you can see it is, and this is Miss Yost, Isle Yost. You are our winner. If you will type in your name and your phone number in the chat, we'll get that privately and we'll have a gift waiting for you. And the next one is Robin. Robin, you're a winner. So if you type in your name, you will have a gift waiting for you. And we thank you for participating in our first segment. Our next two segments are a little quicker. So we'll get you done by the end of our expo, which is slated to end at 11. So this was the most content heavy section. And so we're going to kind of buzz through the next two sections a little quicker, but this was important information. All right, so we're going to progress on, and let me just get my poll down here. I think I can just look at that. The young taught me I knew what to do. All right, so let me get this here, and oops. Hold on. There we go. There we go. Now we're into our second segment. So we're going to talk about hearing challenges in challenging times. It has indeed been a challenging time. 2020 hit, and we started off running in January of 2020 with great high expectations and ideals of things we wanted to do and offer our community. And then March rolled around and things got crazy. Here we start to realize now with hearing loss, it's challenging. It's challenging living in an everyday world with hearing loss. We talked about it, the missing information that's due to the hearing loss, the time delays in that information. I'm not able to process it the same way. I'm sitting in the living room and you say it, and by the time it got to me, I didn't really hear it. I had to ask for a repetition. Hearing aids help. They definitely help. They don't make you have normal hearing. So understanding conversations when you have a hearing loss is challenging, even if you wear a hearing aid. But then enter 2020 and oh my goodness, coronavirus pandemic. Who expected that? That lovely little child in the middle of the screen is my granddaughter. And yes, I had to put her in this presentation somewhere. So she's showing us the emotion we all had about 2020. We were awestruck. Oh my goodness, how do we even continue life? What does this mean? So much anxiety, loneliness. We were shelter in place. We had, even as we got to get back out into the world, or we were able to progress in the world for health reasons, there were barriers. Plexiglass barriers are everywhere now. People have masks on. I already don't understand you, and now you're wearing a mask over your face. We had Zoom meetings and sometimes poor connection. We didn't understand as much, and so many people were trying to connect. There was very poor connection oftentimes. So we felt isolated. We didn't know what the new normal was. We had so many challenges, and we missed being with our family and loved ones, and it was a difficult time. So as we look at all of these situations and how COVID-19 restrictions made hearing challenges worse, they were necessary and we had to go through it, but hearing was exacerbated during that time far more than we realized. We don't even realize how much we depend on the face until we saw people not being able to hear because of their masks. It often showed people too who have had hearing loss for years and been told they had hearing loss that they really were depending a lot more on lip reading and information that they got from the face that they weren't getting with a mask on. So all of these situations created a lot of anxiety and fear of even losing our hearing aids if we wore hearing aids. Now we have sometimes glasses, a hearing aid, and now a mask added to that. Pull that mask off and the hearing aid's gone. I don't know when I lost it. So lots and lots of anxiety over the situations that we found ourselves in 2020 and even continuing on into 2021. This is a kind of a representation of that before and after COVID-19. So before COVID-19, when you met with one of our lovely physicians, you saw these beautiful smiling faces. You got a lot of information from that as you met with them and listened to your care and what they were suggesting for you. And then we hit 2020 and COVID-19, and now I go to my doctor and this is what I see. It's a lot harder to understand and get the information. There's enough anxiety when you have a health issue, but all of our physicians that take care of all of the parts of our body are having to wear protective gear and keep you protected, and you're much, it's really caused a lot of anxiety over, did I get the information? Did I get the information properly? So what will help? Well, if you have hearing aids, wear them, even if you're home alone. This, I cannot stress enough. Even when you are home alone, you need to be wearing those hearing aids. That auditory processing is going to begin to atrophy and die off if you're not getting consistent stimulation to the brain. That ability for your brain to understand what's being said depends on that area of transmission being strong and vital. So you really must wear your hearing aids even when you're home alone and think, I don't really need them. You do. The sounds in your environment are helping you learn how to sort out speech from noise, even when there's not anything else going on. So listening to things, doing some challenging, and we'll talk about some ways that you can practice hearing, even if you are home alone. But wear your hearing aids, just if only to hear just the environmental sounds around you. And then be sure that you're fitted appropriately, that you have hearing aids that are right for you, right for your hearing loss, and that they are programmed properly for you. So today, with all those problems, there are a lot of helps out there for you based on the technology alone, how the hearing aid processes sound. Now with those additional problems with the masks, you can have an ability to get to your hearing aid of any technology level and go in and increase just the high pitches or just the mid pitch range or the bass. And you can manipulate that right on your phone from a Bluetooth option. So you can go in and say, oh, well, I'm going to be at my doctor's office. They're going to have a mask on. I'm going to take this little knob on my phone and pull it up and bring those high pitches up, because I know that's where hearing loss is, and I know that's where the mask affects hearing the most, is in the high pitches. And depending on the type of mask, it can affect it anywhere from 3 decibels to about 10 decibels, 10 to 12 decibels of reduction of high pitch information. So being able to adjust that on your phone when you go into the doctor's office, but then don't have it like that when you're at home and people don't have masks on, is a very nice resource for you. There are also other helps that you can get, remote mics, TV adapters that can take the information from the television. Many of you mentioned you have problems with the television. Send the signal directly to your hearing aids. So that is wonderful. The big worry of losing hearing aids is a big worry. There are things called mask extenders. You can order them online. You can buy them in a drugstore or Walmart. But these are some products that you'll see that you can get that will allow you to hook the mask to the extender and then put that behind your head. I've even seen people wear some that are like a headband, go over the top of the head. Some have buttons on them on the side, so you can hook the mask onto the button and keep it away from your hearing aids. Or you can be creative. We saw a patient in our office do this, and it was brilliant. Take one of these barrettes. I've got the barrette shown here in both angles, so you recognize that type of barrette, but you only need one of them. Hook one end of the mask on one side and the other mask on the other, and hook the barrette, and you can make your own extender, or even tying a ribbon or a piece of yarn on either end and tying it on the back or on the top of your head, a ribbon, and make like a headband. Any way you can do to get it away from the hearing aid and from behind your ears is important, and will help you not feel the worry of that. Here's some communication strategies that we need to think about. Maximizing your listening and communication is going to be vital for you understanding what's being said. So that means for the person speaking to you, it means for the listener or you, the hearing impaired person, it means looking at your environment. It means looking at the technology and the type of hearing aids and what other adaptive devices do I maybe need to get, or possibly even a voice to text transcribing app. Our smartphones today, you can download an app from Google Play or Apple, depending on if you have an Apple iPhone or an Android. You can go through one of those two places and download an app called Ava. And I've got the little emblem that you'll see down there on the screen. This is what you'll see when you download the app. And it's a voice to text transcribing app, and it's free. And you can, when you go to your doctor's office, I have an aunt who's hearing impaired, and she said the most stress for her was going to the doctor's office. And literally she'd get to the front desk, they have a mask on, there's plexiglass, and they're asking her a question. And she said, I know the types of questions they ask me when I check in. They've either asked me my date of birth, my name, my address, but I don't know which question they asked. And it created a lot of stress. So having this voice to text transcribing app on her phone, she was able to just hold her phone out, and as the receptionist told her what they wanted, it types live time. It'll type what you say as well, but you'll see everything being typed on there on the screen, and you know exactly what they're saying to you. So helps like this will get you through these, and there's all types of strategies and things you can think about and look for that will help you. So whose problem is hearing loss anyway? This is the typical hearing loss problems that we see. One person says, they're just not paying attention. The other one says, oh, you're mumbling. You know, I can't hear you. You mumble all the time. Well, we're going to learn that we've got tips for both sides. Communication is a two-way street. So let's look at tips for the speaker, the person talking. Face them directly and do not talk to them from another room. If you got nothing out of today's presentation, but these couple of helps here, this will help change your ability to communicate with your family members. It's the hardest thing to do. If we're in another room, it's much easier just to call out, but take the few seconds to walk in the room and don't talk to them from another room, face them. Here's another tip for the speaker. Get their attention first. It's so important to get their attention. Call their name, do something, wait for that response of them to tune in. Remember, they're not listening. There's a time delay when you have hearing loss, and now they're not even prepared to listen. You want to speak slowly and clearly to them. You do not want to speak loud or exaggerated. Talk in your normal voice, but sometimes just slowing it down. Words run together. So when you talk fast, it all runs together. They are really struggling because of that time delay. And so when you can just slow your speech down just a little bit, a little division between your sentences or phrases helps them understand better. It just makes it clearer. I don't have to shout. If they're wearing a hearing aid, the hearing aid's making it louder. And when they say what, it's a natural response to say, repeat it, but repeat it louder. They don't need it repeated louder. They weren't ready to listen. And then don't cover your mouth. Important that we keep our mouth visible when we can, when we're out in public. That's what we're talking about. That's the challenge. But covering your mouth, you get a lot of information from facial cues. When we are talking around a room or through barriers, and this is important to think about with the glass barriers, when we first start to speak, you know, if it's a nice loud word, I can even be shouting. If it has to go a distance, go around a corner, sound travels, sound diminishes as it travels. If it now has to go through a wall or a window and then get to the listener who's not even prepared for me to speak to them, they're not going to respond. And I can almost promise you that. So here's some tips for the hearing impaired person. Wait for the person to finish speaking. Oftentimes we hear something and we miss one word and we get hung up on that. You don't have to hear every word to get the message. Let me know when you know, I won't be able to see all of you. I can see a few people on the side of my screen here, but just kind of look and see about when you understand what this picture is. probably most of you are starting to know now. Yep, that's the Mona Lisa. So you got enough information, but we had to have enough information revealed for me to get it. So sometimes if I wait, if I'm the hearing impaired person and somebody speaks to me and I don't get it, wait for them to finish their message. Sometimes it all comes in. And I think even normal hearers can relate to that time that somebody said something and you went, what? And then 3 seconds later, before they even repeated it, you could answer them. That's that delay. That's that processing. Processing takes time. So sometimes wait, get more information, then see if you can put it together. If you're not wearing hearing aids, then that has to be addressed for you to be able to do that. Another tip for the hearing impaired person, ask for other people to rephrase, not repeat what they say. If somebody says something and you say, what? You're going to get the same words right back. And if you're missing one crucial word that's just not coming through to you, you're not going to get it the second time either. That's when you start to get embarrassed. You don't want to ask for a third repetition and you nod your head. They think you have the information, you don't. So you need to repeat back what you heard. What did you say? And then repeat it back. Then they know what to clarify. Sometimes you might need to ask them to rephrase it. Give me another word. I'm not catching that one word you're saying after this. Or what's that number? Are you saying 6? S-I-X? They can spell it. They can find another word. Sometimes it's a number and we can say, I'm saying 5. 1, 2, 3, 4, 5. You know, there's lots of things we can do to communicate. It takes effort on both parts and we have to be willing to do that on both sides. Remembering that communication is a two-way street. So you, as the hearing impaired person, can address this communication style in one of 3 ways. You can either be very passive about it, and when we're passive about it, then we just go, oh, I'm just going to hang back. We become that wallflower. We start to change our personality and we say, well, it's my fault, I can't hear you, and I won't participate. That's not helping. It's not helping you stay engaged. It's not helping your auditory processing. It's not helping your cognitive health. Or we can be aggressive about it. And we can say, you mumble, it's your problem. You find a way for me to hear you. I'm over this. And that's not going to work either. Or we can be assertive about it. Being assertive is knowing that you've got to say, I can't hear you when you talk to me from the other room. You need to come in and say that to me in the same room. Sometimes it means you have to get up. As the hearing impaired individual, don't ask them a question if you're in the other room and expect them to come in. You need to go in the other room, say, here's my question, and ask it. So that being a two-way street, you've got to be your own advocate. You've got to advocate for yourself, and you've got to remind those loved ones how they need to speak to you. Tell family members and friends as you sit down, got a hearing problem. I wear hearing aids, but sometimes it's hard for me to catch what's being said. Please call my name before you say something to me. Get my attention first. Reminding grandchildren of that. You need to get my attention first. The more we assertively handle what our needs are, the better you'll communicate, the happier you'll be, and you'll find that you don't run into all these roadblocks that cause that anxiety and anxiousness and that feeling of I want to just disengage. So lip reading is important too, but we get very little on the lips. We get some, and we get good information from the lips, but we get more from speech reading. You know more about what this child is feeling right there by the expression on her face than you do from the actual seeing the sounds on the lips. Very few of our sounds are visible. And so, and some of them look the same. A V and an F can look the same on the lips. So it's important that we get the whole total picture. That's why facing someone when you're speaking to them is so important. Having eye contact and engaging. Again, challenges with masks and plexiglass, we've got to find another solution for those stopgaps. But at home, we need to be remembering this and trying to incorporate this into our family discussions and let everybody in the family know this is a must. There's a list at the bottom there of some auditory training programs. Some of them are at a cost and some of them are free, but Clear, LACE, or Hear Coach by Starkey are some ways you can practice that rehabilitative communication pathway. You can practice auditory training, hearing, understanding. That's listening and understanding are listening and hearing are two different activities, and they have to happen in different areas of the brain. So it's important to work them all. Just like our body, we know if you have an ailment, you have a physical need that we can see. People are going to go out of their way to help you. They're going to assist you. If you are on a walker, somebody's going to hold the door open for you. Our hearing loss, remember, is invisible. Nobody sees that. You walk in a room, nobody sees that you have a problem. So you've got to advocate for yourself. You've got to practice. You've got to practice understanding speech in the presence of noise. You can't do that if you don't wear your hearing aids, have them programmed properly for you, have them maintained regularly, and practice. It does take practice. Here's some tips for some of our environmental needs. We need to kind of sometimes manipulate our environment. When you're eating out, pick a time that's not the peak time when there's the most noise going on in the restaurant. Pick a booth versus a table. Find, a situation where you're near a wall rather than out in the open with sound coming from all around you. Look at the room acoustics. Is it a very hard, porous surface everywhere? Or are there carpets and draperies and some sound buffering? All of those situations you'll find you do differently in different environments. And again, with today's hearing aids, you can pick and choose how you want the hearing aid to amplify in the various environments you're in, and you'll find a way to best enhance that environment. Sometimes hearing induction loops are helpful. There are some environments. Our senior center main auditorium is installed with an induction loop. So whatever is coming through the PA system, I know the Tallahassee Theater, when we're back and having these environments that we can go to, some churches in town have loops, hearing loops. If they have a hearing loop, make sure your audiologist has turned on your telecoil option in your hearing aid, and then you can access that. Whatever's coming over the PA system goes directly to your hearing aids. So even with hearing aids, sometimes you need some extra helps, and this can be one of them for a large corporate area that has this symbol. Looking for this symbol lets you know that that area is looped with a telecoil. Sometimes you'll find FM systems in certain places. An FM system does require you wear their headset and not have it come to your hearing aids, but it can be a help in a large auditorium. Or you may need to move to the front. All of us like to have our pew that we sit in every week, or we like our specific spot in the auditorium that we go to, but sometimes you might need to move more to the front and take that into consideration. If you have tinnitus, ringing in your ears, it can be pronounced tinnitus or tinnitus. You hear it both ways. But if you have that, you may have found that during the pandemic, it has maybe even heightened or worsened a little bit. Anxiety, fear makes that worse. Stress, tiredness makes it worse. And the fact that we're kind of isolated. We're not out in the world where there's lots of sound that helps us to kind of not pay attention and focus so much on that internal ringing or noise sound that you hear. It can sometimes sound like a hissing or a ringing, air escaping. You hear it described as many different things. But there is some resources and some helps for that. There are some resources right here. Again, these slides will be available to you. We're recording this session. Also, these slides can be available to you through the Senior Center, and you'll find some great helps there that you can get to, even telehealth. There are some ways that you can meet with them and talk about some of these cognitive behavioral therapies or retraining therapies that can be very, very helpful. Let's talk about it. Do another poll here real quick, and then we're going to finish up with another few slides, and I'll really work to move our time up on that last section. So we'll run through this poll real quick. What has been your biggest challenge during COVID-19? Isolation, masks, fear and anxiety, or understanding conversation during your doctor's appointments? I'm going to let everybody log in and come up with a response. Appreciate everybody's participation. This is great. We might have, we still got people answering. I'm going to give you another 20 seconds. And we'll go down another 5 seconds in 5, 4, 3, 2, 1. All righty. So you can see our results here. Isolation, 36%. That's a big number. I mean, it's been hard to be isolated. Masks, that's been, I thought masks might even come larger on the scale. Really interesting to see. This is good for us to learn. Fear and anxiety, I think that is just huge. So it's important to realize you have resources. We can be there for you. We can give you some help to help alleviate some of those fears. Let's find out what it is that's the most troublesome and find a way that we can troubleshoot that together. Just like I was fearful of running a virtual meeting, but I found my resource and now I've been calm and confident. So use your resources. So we're going to take another poll now. We're going to stop that one and start another poll. And my resources are kicking in. All right, so here we go. What has been your, what do you wish your spouse or family member understood about your hearing loss? That I can't hear when they're talking to me from another room, that sometimes I have trouble hearing even when I'm wearing my hearing aids, that some sounds really hurt my ears, or if I'm not prepared to listen, I may not hear what they say to me. What do you feel like has been something you wish a family member or a spouse wants to know? If you're not the hearing impaired person, what have you heard as the complaint from someone that you're involved with has said, I wish you understood this? We'll go for another 15 seconds and give you a time to log your answers in. And we'll go 3, 2, 1, and let's get our answers and we'll share those. And we find 20% of you say that you can't, that you wish they understood that you couldn't hear from another room. 20% also say that when you're wearing your hearing aids, that sometimes you still don't hear them. And 60% said that if I'm not prepared to hear, I may not know what they said to me. Wow, that's a large number. So there's our take home. If you are the hearing impaired person, you have to keep telling your family members, if I'm not prepared to listen, I'm going to say what? Pretty soon they'll find it easier to say your name first than have to say the whole message again. So, or if you have a loved one that wears hearing aids, remember that. Take the few seconds to call their name. It saves a lot of anxiety. All right, we're going to now share yet another question with you. And I'm going to try to learn what my, oh, there it is. All right, and we're getting ready to share that question with you now. What is one thing you plan on changing after understanding more about communication? Repeat what you've heard the person say if you are that hearing impaired person. Wait until you hear the whole message before you ask for clarification. Wear your hearing aids more often, or get your hearing tested and see if you need hearing aids. And again, if you are not the hearing impaired person, what do you plan to do more? Maybe give them a little bit of grace when they don't hear it, and remember that you have to give them time to hear the whole message. Maybe it's encouraging your loved one to wear their hearing aids, and maybe that encouragement, needs to come in the form of encouragement and not nagging. But that can be taken as nagging. So sometimes they need to hear it from us, but you can tell them you heard it on good authority that they need to wear their hearing aids to prolong their health. All right, we'll give it, I think we're good. We're going to stop that now and share those results. And then we're going to draw a couple more names. So 33, this is a nice representation of all of them. We're kind of evenly split. 33% are going to repeat what they've heard rather than just ask for a repetition. and then 22% on all three of the others. So that's interesting. So those are evenly split. So I'm glad we've gotten some real good take homes, and that all of those seem to be like something that we can benefit from. Now we're going to have another drawing, and I'm going to draw out a couple of names here. And so we have Linda Oxford. Linda Oxford, you are a winner. If you will chat your full name and phone number to us. And Sue, you are a winner. All righty, very good. So now we're going to progress. All of our winners are going to receive a $10 gift certificate to Dairy Queen. And I'll tell you why we chose Dairy Queen. Hey, we all need a treat now and then, but mainly too, we want you to remember that speech banana. It's so important to be able to understand why speech is difficult to hear and what those frequencies and pitches mean in relation to speech understanding, that we thought about banana splits. And there's where our thought process went. But so as you have your treat, think about that speech banana. How can you apply that to understanding better about how you hear or somebody else hears that you love? All right, so now we're going to get into segment 3, and we're going to pop through this segment pretty quick. Wow, I'm realizing we're going to run a little bit over time. We started just a few minutes late waiting for people to come in. Ruth, are we? Oh, we're 11:30? Why did I think 11? Ruth, we're good?
I believe we are until 11, but it's fine if you go a few minutes over. People seem very engaged, so.
Okay, we won't go too much over, but we'll get through this pretty quickly here, okay? So segment 3, we're going to just talk quickly about hearing loss and other health concerns, because I think it's important to understand that when we have other health concerns, oftentimes hearing comes into play too. So it's important to look at those. I'm not going to go over all of these, but this is a great graph. And again, all these will be available to you. But if you look at the number of things that are connected to a health condition, it's amazing when we start thinking about that. So we're going to look at some of the major ones. The biggest one, and the one we're hearing the most about in the research today, are dementia and hearing loss and how those are related. It's not a one-to-one correlation, but there has been a study that has been going on longitudinally. It's been 12 plus years now. Dr. Frank Lin of Johns Hopkins has studied this and found that even mild hearing loss can double our risk for dementia. Moderate loss triples it, and severe loss is 5 times more likely to develop dementia. Now, that is untreated hearing loss. So the key is hearing aids. If you have severe hearing loss, the key is to not just having hearing aids, not just owning them and having them in your drawer, but having them on your ear and having that auditory processing. Okay, so if from the time you get mild hearing loss, you address it and get amplified, you are less likely to develop cognitive disorders. Okay, it's not direct. It's not because I have one, I'm going to get the other, or because I did this, I won't get the other, but there is a strong correlation to that. So it's really important to address even mild hearing loss. And the fact that the brain scans that they do, where they study how the brain lights up, what areas of the brain are activated when we are communicating, when we are trying to remember something, recall. All of these areas have been studied along with signs of dementia, and there is a strong correlation to that isolation that then develops into depression and then leads to other disorders like dementia. So it's so important to stay connected. That's what the Senior Center is there for, to do, is to keep you connected, and it is vitally important for you to do that. And then having the proper amplification and keeping those pathways stimulated is so very important. Heart disease is linked to hearing loss. So again, no direct causal link between it, but there is strong relationship between the two. And it makes a lot of sense. There are small arteries that require sufficient blood flow to maintain proper function. And so that's important for all the major organs of our body, and our hearing organ, the organ of hearing, the cochlea, is just as important. Diabetes and hearing loss. Uncontrolled diabetes is going to result in long-term high blood pressure, and those elevated blood pressures and blood sugar levels can cause some damaging effects to the blood vessels in the inner ear structure. So it's very important that if you are identified with diabetes and you haven't had a hearing test, maybe you should go get a hearing test. See if your hearing's also affected. Excuse me, just a minute. See if that hearing loss is affected, and make sure that you have that you're maintaining your proper health for all of those areas. And I'm going to take a sip of water. I apologize. There we go. Sorry about that. So you do want to make sure that you are, if you're on medications, if you're insulin dependent, or you're taking medication for your diabetes or any health disorder, you want to stay up with your primary care physician or whatever physician is managing your care, and you want to listen to that doctor and follow that diet restriction or those medications, because that's important for other areas of your body, and hearing is one of them. And so we do damage to one area, we're also damaging another. Falls can be related to hearing imbalance. So lower body weakness, dizziness, the hearing and the balance area are very closely associated, and they can affect each other. So taking a look at and making sure that you are evaluating all of your sensory system is very important. Having vision screenings and tests annually, hearing tests are important. Getting a balance evaluation is important. So talk to your primary care about that if you have concern, but understanding your risk for falls is very, very important, and seniors really need to pay attention to that. It can happen for a number of reasons. So you got to look at how can you prevent falls, work on your balance and strength. Senior Center has some great exercise programs. Take advantage of it. Even though we were in the middle of a pandemic, they kept going and offering things on Zoom. So thank you, Senior Center, for pushing through and offering these continued resources to our seniors and anybody who wants to stay involved. But it's important to maintain that flexibility and that strength. So participate in that. Review your medications with your physician. Sometimes medications can have some additional risks for balance problems or falls. And then take a look at, do I need to be referred to a balance professional? And looking at your home situation, do we need to add handrails somewhere? Are there small carpets around? What are some lighting improvements I can make so that we can remove tripping hazards? So looking at that and taking a look at that, and then being sure to tell your family and friends that you have a risk for falls is very important. So as you're walking to and from a restaurant or getting in and out of the car, you've got people helping and assisting. Walkers and canes, as much as we don't like them, they're there for a reason and they protect you. Safe exposure times to noise are very, very important. Noise exposure is a huge risk to further hearing loss. It's cumulative. We're going to close real quickly here, but I don't want to not mention this. Oftentimes people have hearing loss because of noise exposure, more times men than women, but many women too. But because you have loss already, doesn't mean you don't have to protect your hearing. You're not free from that. You do need to continue to protect your hearing because loss is progressive and noise exposure is cumulative. So I like to liken it to a blade of grass. Think about a plot of grass, a freshly laid sod in a yard. That grass is very pliable. If I walk over that grass and make a pathway from the sidewalk to the door, across the grass, you don't even know where I walked. That grass sprung right back up. So remember, in the cochlea, that little tiny organ of hearing, those thousands and thousands of tiny microscopic hair cilia that are moving around in fluid to send information to my brain about pitch. The ones that are the ones that are most exposed are those high pitches. Every time there's a loud sound, they get bent down. After a while, they don't spring back up. So just like walking over that plot of grass, if I keep taking that same trek every single day, eventually that grass will not spring back up. And so when we do that, that's cumulative damage. And that's what we mean by cumulative damage. So if you already have noise exposure, or you already have high frequency hearing loss, you are even more at risk being around noise. There are options on your smartphones today where you can go into the help area of your settings and set for alerts. If I'm listening to sound that hits 90 decibels, about 85 is your cutoff. I can be in 85 decibels of sound for 8 hours without risk of damage. Okay, so if you'll notice there on the left side of the screen, that's the continuous decibel level. And on the right side, how long can I be in that? It's not a linear change. If you notice that as we go up in decibels, sometimes just 1 or 2 decibels changes by a significant amount. So if you look across here at, if I'm listening to continuous 91 decibels, I can stay in it for 2 hours safely. Just increasing it by 3 decibels, I can only be in it an hour. And then just by decreasing it by another few decibels, only 30 minutes. So you've got to be careful. If something gets in the really loud range, and your phones can now measure, so you can even get a meter, an app for a sound pressure level meter where you can measure what's the loudness of something. So you can kind of see, well, what's my safe time to be in that? You can have your phone alert you that if you're listening to something that's getting above a certain level for an extended period of time, it'll send you an alert you're listening to something too loud. So important. On a device that you're listening to with a volume control, halfway is about your cutoff. You don't want to listen to anything more than about halfway for any extended period of time. All right, so that gives you some information about that. We're going to have a few more questions and answers, 3 more and 2 more winners, and we'll wrap up our meeting for today. Sorry, we ran over a little bit, but here comes our question. You can see, if I wear my hearing aids, I don't need to worry about hearing protection. True or false? We're going to make this easy. True, false. Give you a few seconds to give me a answer on that. And I'm hoping that we're all going to get 100% on that. And everybody's chiming in. Still got some responses coming in. We'll give you another 30 seconds. And we're going to go ahead and, I think we're all in. I think we'll go ahead and cut that off and share our response. Everybody got that right. If I wear my hearing aids, I still need to worry about hearing protection. So hearing aids need to come off. Hearing protection needs to come on if I'm going hunting, or if I'm mowing the lawn, or using a leaf blower. All right, let's get to our next one. Did I get the next one? Okay, and now our next question is, listening to hear and understand speech with hearing aids requires time and consistency. All right. We won't go a full minute for these because we got a true false. You got a 50-50. You can get that pretty quick. I'll wait till I think everybody has voted. Get your votes in. Learning to hear and understand speech with hearing aids requires time and consistency. And we'll go ahead and cut that off and share that. And indeed, 100% of you got that right. You are a quick study. Yes, indeed. We have to wear them. We have to wear them continually to maintain and get that progress that we want to see. Anything we do, we have to do continually, and it takes time. All right, we're going to come up with our last one. Whoops, I went too fast. All right, here we go. Taking care of my body by eating correctly, getting good rest, and drinking plenty of fluids is important for my overall health and well-being. You got a true, false. If anybody gets this wrong, Ruth Nickens will come after you personally. And we'll give you a few more. I feel like everybody's probably responded. We'll cut that off and there we go. Share our results. 100%. That is very true. Ruth is very happy. She's clapping. So yes, please be aware that, we're tired of hearing it. Every time you go to the doctor, it's like, you need to be drinking more water. You need to be exercising more. You got to watch your diet. Are you getting plenty of rest? We get tired of hearing all that. It is more important now than ever, not just because of the pandemic, which is true, because of the added stress and anxiety levels. It's even more important to stay rested and take care of ourselves. But it's true because our world is getting faster and faster paced. And there's always good and bad with that. We have great technology today. We have great access to things because of the technology, but it also increases a heavier load on the things we have to do and the things we're responsible for. Taking care of your body is so very important, and it all comes into play, and it's all important, and it's all related. So it's important that we take care of all of it. I do thank you so much for the time that you've allowed me to come and share with you today. I'm going to click off of this, and we do have a slide that's going to have my information on it, and we're going to pop that up for you, and my name and phone number will be there, and I think even my email address is on there. Feel free to contact me in any way if you need. There we go. In just a second, you're going to see that, because I have an incredibly fast technical whiz over here. And I really feel like everybody should have a Jordan. It's kind of a necessary thing in life. And if you don't have a Jordan, I'm so sorry for you, but I am so thankful that we have a Jordan here today. She's been wonderful and helped us with this. And we're very, very, very happy for that. So we're getting ready to pop that up for you. It's coming. It's coming. It was not in my presentation, so you can't imagine the incredible gyrations she's doing because I forgot to put that in there. So I appreciate her, but it should be up now, I think. Is everybody seeing that? Yes. Okay, good. So there I am. Feel free to contact me. The phone and website, email address, excuse me, and our website's out there too. Check our website out. We put helpful information out there. We put tips out there now and then. If you're not following us, get on and follow us. There's good information out there, but feel free to either call me or send me an email, and I'm happy to get back with you. If there were any questions that we could answer for you specifically, don't hesitate to get with me. And I thank you, Ruth. I'll probably open it back up to let Ruth unmute her mic and share if there's any last minute things for you to share.
Well, thank you so much, Lisa, and the whole